Welcome back, everybody. Thanks for hanging in with us on this day. It has been such phenomenal people. You know, they say when you sit with the winners, the conversation is different. And I feel like everybody that I've had the honor to sit at the table with, including all of you watching from across the globe today, has been really phenomenal as we are all in this right kind thing for kids and their families. And so this next session that we're going to step into is actually called Better Together. And it's really reflections on building strong partnerships in research. And this is sort of the second part. This session will feature a panel discussion from the KBHN project ABLE2 Alcohol Resource Program. And it's a stakeholder-driven project, as we, just sort of talked about, to support children and youth with FASD and their caregivers, right? Because if the people who hold them aren't okay, these kids don't stand much of a chance. And I love this idea of really taking this into the family system. And I'm so excited for you to lean into this. This session will explore some of the lessons learned and the diverse processes that each have taken to achieve better outcomes for kids and their families. The sponsor, a huge thank you to the Canada Fetal Alcohol Spectrum Disorder Research Network, CAN FASD, and the Children's Hospital of Eastern Ontario, CHEO, for sponsoring this beautiful session. Our moderator, I'd like you to meet is Manon Kelso, phenomenal, Fetal Alcohol Resource Program Manager for ABLE2. Manon, this is right over to you.
Thank you, Dr. Carrington. I'm really excited to be presenting today, and joining me on the panel is Krista James from CHEO. She manages the diagnostic services, which includes, sorry, can you hear me? We're good? Okay. So Krista manages the diagnostic services at CHEO, as well as the new multidisciplinary diagnostic clinic launched in March. She also oversees behavioral services and collaborates with ABLE2 for the delivery of the provincial FASD worker program. And we also have Maude joining us, who is a neuroscientist, PhD student at Queen's University, under the supervision of Dr. James Reynolds, and works alongside KBHN. She's also a registered social worker, psychotherapist, and speaker, and she was also one of the founding members of the Fetal Alcohol Resource Program about 6 years ago. So we are going to play a short video that will go over some history of FARP and some of our stakeholders involved in the program over the last 6 years. If that video can just be launched now.
Hi everyone, my name is Heather Lacey and I'm the Executive Director of ABLE2 Support for People with Disabilities. ABLE2 is a small but powerful charity with a big purpose. We're the only organization in Ottawa that supports people of all ages across the disability spectrum and their families to live lives as valued members of their community. Operating since 1974, ABLE2, formerly Citizen Advocacy Ottawa, is in its 47th year. Throughout those 47 years, ABLE2 has evolved and grown. However, one thing has remained the same: our desire to have an inclusive community where all people are seen as able, important, and valued. Through our matching, build community, fetal alcohol resource, person-centered planning, and funding brokerage programs, and our sibling groups, we strive to deliver on our mission, to work with partners to provide the tools, choices, and connections that empower people with disabilities to build lives of meaning and joy. Each day at ABLE2, programs and services are delivered rooted in our core values of honesty, responsibility, open access, personal advocacy, value of all people, and independence. Through continuing partnerships like the one that you'll hear about today, I am confident that ABLE2 will continue to improve its programs and meet its goal of an inclusive community where all people are seen as able, important, and valued.
Hello, I'm Manon Kelso, the Program Manager for the Fetal Alcohol Resource Program at ABLE2. Launched in 2015 to raise awareness about fetal alcohol spectrum disorder, the Fetal Alcohol Resource Program has demonstrated significant and consistent growth. Initial service delivery was in navigation to community services, FASD training, and research. The program began with an anonymous donation to the Ottawa Community Foundation to develop services for individuals with FASD. The Community Foundation then approached Citizen Advocacy Ottawa, now ABLE2 for leadership. The program seeks to constantly find new ways of responding to identified needs. This means that the program is less defined by its service delivery than by the preoccupations of caregivers and individuals with FASD. The program expanded its service delivery over the years, building strong community and funding partnerships with Kids Brain Health Network, CHEO, the Children's Aid Society of Ottawa, and Health Nexus, as well as strong community partners from a variety of sectors. The provincial FASD worker program has strengthened the working relationship with CHEO in ways we couldn't have predicted.
Hi, my name is Krista James. I am the CHEO manager that oversees the FASD Diagnostic Clinic, and I work closely with ABLE2 and FARP on the FASD worker program. CHEO partners with ABLE2 and by extension FARP, formally through financial support and oversight of the FASD worker program. The FASD worker program is one of the many programs under the FARP umbrella. However, our partnership has grown in many ways. CHEO relies on FARP for ongoing FASD education of our staff. And in 2021, CHEO launched an FASD diagnostic clinic. And though we don't formally partner with FARP on this program, their expertise in FASD has been a resource to us in building our clinical process, education of the team, and connecting to the greater FASD community in our region. FARP has also experienced informal wins from our partnership. FASD workers report their better understanding of the CHEO structure and processes has reduced confusion for families and increased access to services. Furthering our partnership, we now have a social worker who is partially an FASD worker and partially the social worker in the FASD diagnostic clinic. Having an individual as part of both teams has enhanced transparency, communication, and flow of information, all with the focus of simplifying the journey for individuals, families, and ensuring they are fully supported.
Good morning. My name is André Guillemette. I am a service manager with the Children's Aid Society of Ottawa. I oversee areas of child protection services, as well as foster care, adoption, and kinship services. I'm very proud to share with you today that the Children's Aid Society of Ottawa has been both a funding partner and an active member of the Fetal Alcohol Resource Program since its inception. In doing so, families have benefited from the Fetal Alcohol Resource Program in many ways, but most importantly, in supporting families to navigate systems that can be complex, such as the education system and the justice system. And without that support, families would struggle in more significant means than they already do, given the challenges that are brought before them in ensuring that youth and children with fetal alcohol syndrome are properly supported. I thank you for your time this morning, and I wish you a great day. Thank you.
I have been involved with the Fetal Alcohol Resource Program since its initial implementation, first as a staff member and now as a PhD student. I assist and collaborate with the program in evaluation, planning, and as co-creator of knowledge and innovation. From the moment FARP reached out to KBHN to fund and to support the program, KBHN played a key role in providing the latest evidence in FASD and also gain in knowledge by hearing directly from the needs of the community. As researchers, we first and foremost want to listen to the needs of families and support programs like FARP so innovation can reach families in a timely manner. Our panel will describe how beneficial this partnership has been to our research, to the program, to their other community collaborators, and of course, to the families.
Without the involvement of all of these stakeholders, including families and individuals with FASD, we wouldn't be where we are here today. Improving lifetime outcomes for individuals with FASD through early identification and proven interventions, by reducing stress and supporting connections for caregivers and individuals with FASD, and by encouraging people with FASD and their support networks in planning and implementation of the program. Thank you.
Okay, so that video covered the history of our program, and like mentioned, we've been running our program with the kind support of Kids Brain Health Network for just over 6 years now. So FARP, the Fetal Alcohol Resource Program, has a few different core pillars that have been, as mentioned, at the core of our work since day one, which is around the research and the community support that we offer. So we, of course, rely on KBHN to help us with the research component, which Maude will discuss a little bit later on. Community support has always been in the roots of FARP, where our goal is to continue building an FASD-informed community to respond to the needs of children, youth, and their parents. We've incorporated a few events to raise awareness and to continue building capacity in our work. And we partner with CHIO on delivering the fetal alcohol spectrum disorder worker that is available to anybody across Ontario. But in our regions, we cover Ottawa, Stormont, Dundas, Glengarry, and Prescott-Russell. And that program offers direct family support, system navigation to the families, access to support groups, and capacity building within their networks. At the root, our primary stakeholders in the program will always be the children, youth, and the families that we support. Connor was going to join us today and unfortunately couldn't make it, but he recorded a little clip to share with everybody about his experience with accessing a program like FARP.
Hi, my name is Connor. I am 17 years old and I have FASD. FASD stands for Fetal Alcohol Spectrum Disorder. Ever since I was a little kid, I wondered why I had the struggles I had. I had a lot of difficulty in school understanding my teachers. Because I couldn't understand, I would often cry or get angry. Some of my teachers had a hard time understanding my reactions, and I have an even harder time explaining them. My mom had to pick me up from school many times because I couldn't calm down. I still struggle with my emotions today. As a result, I can only go to school part-time because that is all my brain can handle. Last year, things became very difficult for me, and my mom had to reach out to our local Fetal Alcohol Resource Program for some support. Right away, I became a part of a support group for young people with FASD. I was nervous at first to join, but I quickly felt like I was accepted. I was not alone. There were other kids like me. I was no longer alone in my struggles. This group understood me and supported me. I was also able to join a video game group and take part in the FASD Awareness Walk. This has been life-changing for me. I finally feel like I belong. I can open up now about my struggles. I want others to know that they don't have to be alone. This is why FASD awareness is so important. No one should have to struggle with this alone. I really want teachers and doctors to understand. I need them to be patient with me. I need them to see that behind my behaviors, I am trying to be the best teenager I can be. Every day is a struggle to make my brain do the right things. I just want to be a normal kid. Hopefully with more awareness, kids like me can get the support we need to live the best life that we can with the obstacles we have to overcome. Thank you for taking the time to listen to my story.
So that's Connor. Like I said, unfortunately, he can't join us to answer questions today, but he wishes you all a good conference. Over here, we've just got a few of our partnerships that have been created over the year, whether they're community partners, financial partners, referring partners. They've all been a great part to make FARP so successful and involved in wanting to understand and creating an FASD-informed community. So we're going to discuss first the process of partnership, and I'd like to invite Krista here to chat a little bit about the process that CHIO and FARP ABLE2 took on to start building FASD supports in our regions.
Sure, thank you. Partnerships between CHIO and FARP really started as CHIO lending a meeting place and some, basic financial support. But over the years, that partnership has really grown, and I really want to highlight today the informal partnerships. I did highlight in the video some of the formal partnerships in terms of the FASD worker program, But I think it's the relationship and the informal partnerships that have really benefited the individuals we all support, but as well as the staff in both our centers. So informally, we partner around FASD education for staff. We have open communication that really works to provide feedback to each other that has allowed us to simplify processes that really do benefit families in creating a simpler journey. And even the open communication has really supported our staff in each of our different centers to really understand the other organization and what they're doing, which again translates into a more supportive, simpler journey for families, which we know is key, and the individuals we support. We sometimes create so much chaos for individuals and families just not understanding each other and not working together well. And I think that's something informally we've really been able to tackle. We also rely on each other in terms of our areas of expertise. So as Manon mentioned, CHEO did start the diagnostic FASD clinic in the spring and really relied on ABLE2 and FARP to connect us with neuropsychologists with an expertise in FASD, connect us to the FASD community, training opportunities, and in an ongoing capacity, the FASD workers continue to provide us feedback in terms of the family experience and their experience supporting the family, and we've been allowed to adjust some processes based on that feedback. I think the most beneficial and exciting part for me, and I think Manon would say the same, is also really our open conversations that allow us both to live in the gray a bit. There are individuals and families that we both know and support that don't nicely meet in either of our mandates, but we are able to touch base, to talk, and to figure out how can we leverage our two programs and our two organizations to best meet the needs of these families and individuals, and we've done a good job of doing that as well.
Mm-hmm. Absolutely. And as Krista mentioned, the partnership between the Fetal Alcohol Resource Program at ABLE2 and CHEO has not only been financial, it's about really bringing two models of care together to better serve the families affected by FASD. It took many years to get our relationship to the point that we are at now, and we continue to really focus on getting the appropriate care for the families we support in the system, in the community system, as well as the healthcare system. And we're going to go to some of the lessons we learned along the way in developing our partnerships. Krista, I'll invite you to touch on that.
Yeah, I think one thing that's been done well, and I think definitely there was growing pains, is really learning where your expertise lies. I think no organization can be all things to all individuals, and I think really owning your expertise and knowing where your strengths are and where to reach out for the other organizations' areas of strength. So I think we've done that really well with FARP and ABLE2, and we really do rely on FARP to inform the work that we do around FASD. Being humble, being able to ask for feedback, direction. And I really think that open communication has been key. I think any bumps along the road would have been avoided if we had done that better at the beginning, but I think we're doing a great job of that now. And I think it's owning your expertise and knowing when to reach out.
Absolutely. And I think because of the open communication between the partners, we've been able to identify new service gaps and different directions to move forward. Having a team at CHEO representing FASD is so important to continue to grow capacity. For those of you that don't know, CHEO is a rehab center, it's a children's treatment center, it's a hospital, so it's really a centralized area where people go for care. So having an FASD team in there that collaborates with us, who are community-based, has been such a great partnership to be able to leverage different areas of connection to continue to build that capacity. So we're going to touch on successes and challenges. So Krista, I'll pass it over to you again. So what worked well and what would you do differently?
I'm not sure I would do anything differently. I'm sure others who are part of this early years of this partnership may have other thoughts, but I think the missteps and the misunderstandings have really we've learned both more about FASD on the CHEO side, but I'd also suggest that ABLE2 and FARP learn more about the medical and developmental side from the CHEO lens. And I think those missteps have led to difficult conversations, but I think those difficult conversations have led to an overall better understanding and a stronger relationship.
Absolutely. And I think that the important part of this is that they were lessons learned and new goals were created to continue minimizing these missteps and continue, again, to build on our relationship to better serve the community. And what would you give in terms of advice for different community programs or different partnerships that are looking at getting established out there?
I think it sounds kind of silly, but what comes to mind is really it's not a turf war. There are more individuals in need of service than there are services, and that's something that we all struggle with across, community and healthcare services. And I think knowing your expertise, being an expert in your area, but relying on your partners to be the experts in their area, really is the best way to serve families. I think living in the gray sometimes when there is no clear service, and being able to communicate along the way to make sure that we do support all the individuals that are in need. I think another key piece is to not take offense. I think coming from the assumption of everyone has good intent, it's a lack of knowledge or understanding, and looking at it as a learning opportunity versus an offense is also key.
Great. Thanks for sharing your insight, Krista. So as mentioned, we were really highlighting the partnership here. One of our many partnerships at ABLE2, we were highlighting the CHIO partnership. But I'm going to pass it over to Maude now, who is going to go more into detail around the research that happens at FARP.
Hi, everyone, and thank you, Manon. So I won't be talking about research results, but more about how KBHN has been partnering with the FARP program and how it's really enhancing the work that they do, but also enhancing our research. And most importantly, it's benefiting the community. So since the implementation, KBHN has provided funding, but they also provided guidance on the implementation and different ways to support the program. Right now, we're working on a cost analysis for FARP. We are also partnering to have experts to give us advice on the program sustainability. So even our evaluation, the way we look at the program, the way we evaluate, it's to think about it in terms of looking at the community's needs and helping FARP adapt to these emerging needs. So to give you a very concrete example, last year we had a partnership with MyTax, KBHN and FARP, and we did a study on the impact of the pandemic on families raising children and youth with FASD. And this study really helped us and helped FARP know how to adapt to the needs of families. So one minor example was having smaller online group, because their groups were much bigger when it was in person. One of the findings of this study, if you want to know more, it's on the KBHN website, was the higher rate of aggression of children and youth towards family members. And when we saw this finding, we were able to inform FARP, which they had already heard about, so they could adapt their services, but it also informed us to know about the next step for research. So research are not only about our own curiosity about from the research perspective, but about what the community is asking for. So this led us to plan a pilot study that is not in collaboration with FARP, but the FARP clients were able to be invited to be part of the pilot study. So this collaboration is really, to me, it's very equal. We're helping each other constantly. And so because FARP was initiated as a research project, it's very much for us a good way to enhance the work that we do and support them in how they're supporting families. So I'll pass it over to Manon.
Oops. I just lost my slide. So okay, there it is. What's next? So there's still a lot of work to be done. Maude has identified different gaps that we're doing research in right now to continue informing our services, but a significant gap within our community that we've encountered is that, lack of referrals to FASD-informed services. So there's still so many services that still close the door on the families we support and say we don't know how to support them or we're not equipped to support them. So we're continuing to build that capacity within our community by offering customized workshops to those sectors, offering professional consultations, offering those navigations. And it's really about continuing to build that community capacity to respond to the needs of people of all abilities. Together, we've also identified systemic gaps in early intervention, behavioral support, developmental services, which we continue to collaborate on with different partners to address those needs. Krista, do you have anything to add in terms of the gaps that we see within services?
No, I think that you highlighted them well. I think definitely within the FASD diagnostic clinic, behavior supports comes up quite often in terms of a gap, as well as the developmental services area. And I think at CHEO, where we want to leverage this partnership is to build on what already exists. We want to use the research to help inform the services, but also look at, what exists within CHEO that we could look to, enhance to also then support individuals with FASD. And I think becoming more informed and being an organization that's developing more and more awareness and understanding of FASD, and then leveraging the services that we have. We do have department that's focused on developmental services and mental health services, and I do think that there's a way to continue to build this partnership and continue to explore what exists, but how can it be enhanced to also address the gaps within FASD.
Mm-hmm. And Maude, in terms of research, what do you think is next steps for the program?
Mm-hmm. For us, so recently we provided FARP with a student to organize all the data that they had in the past few years. So looking at what sector people are usually requesting services for. So for example, do they call for justice issues, education issues? So by looking at this data, we'll be able to help FARP advocate for funding to make FARP sustainable, but also to understand the needs of the families better. So I think working on sustainability is a major challenge, and certainly if we lost FARP, that would create huge gaps. So we want to keep it going.
Thanks, Maude. So we are going to open the chat. So you should see a chat panel on the widget, I think is what we're calling it in this platform, on the left-hand side of your screen. If you want to ask us any questions, feel free to put them in there. And as you think about your questions, I think there might be some coming, but I just wanted to start off with one for Krista. You mentioned the new multidisciplinary FASD assessment clinic that launched this year. Do you want to chat a little bit more about it and the impacts this service has had on the families and the community?
Sure. The FASD clinic is a win, I'd say, for families in our region. It's a multidisciplinary team that's really focused on diagnostics. Historically, families in our region had to navigate a number of pieces of the diagnostic process independently before completing the assessment. So they had to come with a psychoed assessment, for example. I'd say the impact has progressed further, though. I think FASD has a stronger footprint at CHEO now, and learning about the clinic and the supports that go into the clinic is increasing the knowledge and awareness of FASD across our organization. For an example, we've been asked to have residents start observing the diagnostic assessment clinic, which, these residents are the individuals who will be the next pediatricians in our region, and for them to kind of part of their education to really learn and see an FASD assessment and learn more about FASD, I think is a really great win for the whole community.
Absolutely. So in the chat, we've got a few comments, beautiful comment from a parent who's accessing our services, who's very grateful. Comment for Connor for speaking and really being genuine in his video. I will pass the message along to him. I know he was really excited to be a part of this today. There's a few technical questions around the video being accessible later. I think you have access to it afterwards. I think you can click on the session and review it afterwards. And I know there's lots of people here, so if you have questions, feel free to put them in. We can keep chatting a little bit more. In terms of informal partnerships, we chatted about how we've complemented each other's services. I think for us as a community services, we rely on CHIO for a lot of referrals that we send over. And sometimes we don't know which door to knock on or which department to knock on for a certain service because CHIO is such a big institution. So this relationship has really helped open that door and ease the way to access services in the community. And I know, I think for Krista, it's kind of the other way around, right? Like accessing community experts in FASD, they easily can knock on our door and have that exchange in very informal ways. We were part of a lot of consultations when the clinic was being established. So again, it's not part of our formal written agreement, but we, again, just want to do the best we can within the community we serve.
One thing I'd add to that, sorry to jump in, is we've actually recently, we actually have one staff that we've recently hired who actually works in both teams, which was a little bit of, I don't know if pilot's the right word, but no one was really totally sure how that was going to work, to have an individual who worked in CHIO, but also as part of the diagnostic clinic, but also worked as an FASD worker. So I think that has actually gone very well. I think it's been actually a huge win on both sides, and I think it's even better for the individuals and families we serve. And I think it's also been a support for the FASD workers. But I do think trying things that are new and being willing to kind of think outside the box and try something different and explore, but trusting that within that partnership, you'll be able to navigate those conversations about if this is working or not. I don't think either of us knew how well it would work. I think we both agree now it's working very well, but definitely would encourage to take risks and to do things differently and explore kind of new ways of providing service. Has been another interesting journey this year, but I think a good experience.
Absolutely, and it really speaks to bringing those two models of care together. That FASD worker, social worker is part of our team meetings, is really part of our team and our culture at ABLE2 in offering support to families that have children and youth with FASD, but is also in at CHIO, so is part of both teams. And as Krista mentions, there were some missteps along the way that we were like, okay, eventually we decided she's on too many teams, so let's figure out which team she really needs to be on and focus her expertise. But she's really ingrained now in both teams, and there were lessons learned along the way, and it was so important for both programs to be open to the feedback with that.
Mm-hmm.
Still no questions. We covered it all, guys. Moda, I'll pass it over to you. Your journey in the FASD community, I think, has been quite interesting. I know you've been in the field for many, many years in many different positions, and now you're working on your PhD still in the field of FASD. So do you want to just speak about your journey a little bit from pre-FARP to FARP, and then the next steps for you?
Yes, so my journey in FASD started in 2006, and the province of British Columbia initiated the FASD worker program. So I was, I don't want to say the first one, but one of the first ones in the province in Vancouver. And as you can hear, I'm Francophone, I'm from Quebec. So when I moved back here, I'm close to Ottawa. I was approached by Janet Carioni. They had created FARP very recently with Tana Eichler and Nancy Lockwood. And I could bring the Francophone expertise. So I joined the program, did my master's, became a psychotherapist in FASD as well. And just learning, going to KBHN meetings, I was really interested in the research piece as well. and was just so in love with FARP as well. So I just sort of switched roles. And I mean, in terms of collaboration, it has really helped because Manon and I were colleagues, so we know each other really well, and we can just have this open communication often, how to figure things out, how to do research that will actually have an impact on the community, and how to even think about breaking down silos and making things better for families. I think we use each other a lot, each other's brains to try to enhance everything. Yeah, just having a different expertise, I think, and it's been a great journey.
Thanks, Maude. So it was brought to my attention that I wasn't quite looking at the right spot for questions. There's a chat and a Q&A. So in the Q&A, we got can you speak more about the process to connect a diagnostic clinic to an FASD worker program so that other regions can learn from the close-knit connection to improve referral pathways and early diagnosis and intervention, so that we can provide feedback on the unique model?
Sure. So at CHEO, we have an intake team. And so all referrals for our FASD clinic come through that intake team. Part of the role of the clinic social worker, same individual who works at FASD worker, did some sensitivity training with our intake team, because we really felt that it was really important that even though it's an intake team, that they be also FASD informed, and that they really have some strategies to really support the families and individuals as they refer. It's a really, challenging, difficult decision sometimes to make that referral. Part of that intake process is they do recommend an offer to do the referral to the FASD worker program. So if a family consents, they will complete the referral document and send it to the FASD worker program. So from the family perspective, they've done one intake and they gather that information. That information is shared. And from, we do the mailing and faxing and all those pieces behind the scenes, but from a family perspective, it really is back to that one door and that supported journey. In terms of the FASD worker program to us, I believe, and I'll correct me if I'm wrong, is we do require a family to call or a physician, but the FASD workers, there's been multiple times that they've been with the family for the interview, called with the family and supported that process, and are able to support kind of that initial phone call. And our intake workers have ensured that if requested, that FASD worker is part of that intake interview.
Yep. Thanks, Krista. One of the other questions we got is, are there plans to have FARP services support model made available beyond Ottawa and Ontario? That's a great question. That's something that we're working on with the implementation science team at KBHN around manualizing the program, figuring out what kind of package, what kind of consultations we can offer. And again, it's still in the mid to early stages, but it is something that is in the works. Across the province of Ontario and in British Columbia, there are similar programs like the FASD Key Worker Program or the FASD Worker Program, but none of the programs or in Ontario, sorry, I'll speak for Ontario specifically, none of them have quite a program like FARP. So they offer the FASD Worker Program, but they don't go beyond the different areas like we do. So the research, the community consultations, the capacity building, the customized workshops. So FARP offers a different layer of expertise that across the province isn't the expectation around the funded program. So yes, it is in the works, and hopefully at one of the future conferences we can present that to everyone. And one of the other questions that came through was, what would it entail for the relationship to become more formal and permanent? I'll speak first, Krista, and you can jump in. I think there is a formalized component of the partnership. So it's clear we have a service contract agreement together where we offer the FASD worker program in collaboration. We offer that capacity building in collaboration. We have a shared worker who's on both teams. So all of those partnerships are formalized, but we also acknowledge that the informal parts of it have been so beneficial to the community that we could put something in our service agreement that is, anything that benefits the community, or we can add another clause. But I think it's given us the flexibility to be creative and given us the flexibility to be flexible and explore further possibilities within our partnership.
I agree. I think where it sometimes needs to get formal is when you're looking at dollars and cents, and when you're also looking at creating new care pathways that are different. But I think understanding and optimizing the informal pieces, I think, are important and key. And I think sometimes we get bogged down into the details, and that's not always that becomes more cumbersome.
And we have another question here. So how will the research you conduct with Kids Brain Health Network help you design specific interventions to assess success or failure in service delivery over time? So in other words, what lessons have you learned 5 years in supporting individuals with FASD and their families? I can partly answer it, and then I'll pass it over to Maude. But I think, some of the research that was done, research is done to identify those different areas of service delivery. And there were some pieces that we weren't expecting would be such a high need for support. So for example, the research we did at the beginning of COVID, where we identified that there's a significant need to support families with neurodevelopmental disabilities experiencing child and parent violence within their home. We were aware of the problem. We weren't aware of the severity of it. And that's been part of informing Maude's PhD research and different interventions that could be applied and explored to support that area. Maude, did you want to add anything?
Yes, I would add that so it's very different to evaluate a community-based program and an intervention. It's not like we can do clinical trials, because what you guys do is very flexible and you just adapt as you go, which is really good. And when we did the MyTax, clients had a very high level of satisfaction of the services. And I don't want to say that sometimes it's like, oh, it's a fail. It's not a fail. It's just some people would say, I need more phone calls, or I prefer this way of communicating. So it's not a fail. It's just like, oh, it's nice to be aware that people have different needs, and we have to find ways to adapt. Am I answering the questions right? Do you think I should add something, Manon?
No, I think that's great. I think we often identify the needs based on the feedback that we're getting from, again, our primary stakeholder, which is the families we support. But we're always looking to improve. So if it is something that's more phone calls or easier access to connect, that's definitely something that's we're hoping to embed in our services. And then lessons learned over the last 6 years of supporting individuals with FASD. I think it's a complex system. I think, I know saying it takes a village, every service will say that, every program will say that, there's so many areas that use that, but it definitely does, right? People with FASD need access to healthcare, community-based services, recreational services. They may touch the justice system. They may touch the child protection system. So when you think of all of the systems involved in supporting one person, it really takes a village to support that person to get equitable access to support. And it really, you need champions in all of those areas to understand the needs of people with FASD to be able to respond. So, the wording, it takes a village, I think gets to me, because it really does. Not one person that comes to our services has the same identical needs. And we're always reaching out to new areas in our village to get services for them. So on that note, we've managed to answer all of the questions. I hope we answered them appropriately. Our contact information is available on our little button there if you want to reach out to us with more questions. And from here, thanks Krista and Maude for participating, and I will pass it back to the MC, Dr. Carrington.
Oh, thank you so much, Manon. That was so phenomenal, and I really love Connor. Thank you. If you get to watch this back, or if you can pass that back on to him, what a star! It was an honor just to listen to his story, and I really love the integration of that, the research part of it, and really investing with, the people who really matter, right? The people that receive our services, and so I love that discussion. And, again, this idea that it all comes back to relationships. I mean, isn't this the truth? I mean, we were never meant to do any of this alone, particularly, when you're navigating the system as a clinician or a practitioner, as well as a service receiver. And I think that was just so beautifully highlighted in that panel discussion. So thank you all for joining us here today. On that note, we're going to take a break. Everybody, we have a 15-minute break scheduled before we step into the world's biggest panel. I will tell you, you wait to see what we got in store for you, because this is a phenomenal group of people. We're going to step back in after 15 minutes and talk about It Takes a Village. So stakeholder engagement as a critical lens for the national strategy development and implementation. So you'll see, take your break, please get up, walk around, grab something to drink, and then come back and make sure you click on that tab on your left-hand side. And then we're going to jump into this phenomenal panel discussion. So I'll see you right back here right away.